Hey parents, because a child's brain, aka the starting point of their whole central nervous system, doubles in size during its first year of life and then continues growing and developing at that rapid pace for the first 3 to 7 years of life, making sure the system is working at full function is simply the most important exam and assessment that any pediatric provider could ever perform for your child. While traditional medicine relies primarily on symptoms and looks for obvious pathology on standard exams like blood work, MRIs, and EEGs, our practice uses incredible technology called the insight scans that accurately assess the health and function of the central nervous system. If your child struggled with colic and frequent crying as an infant, excessive tantrums and meltdowns as a toddler or preschool-age child, motor coordination and speech delays, sensory processing and emotional regulation challenges, ADHD, anxiety-type challenges later on, these are all signs that point to a stressed out, tense, and stuck central nervous system. Sadly, most pediatricians dismiss most of these challenges as normal and tell parents today things like, "Don't worry, they'll grow out of it." Well, now we know that for most kids, those symptoms and conditions are obvious signs of trouble brewing in the nervous system. When we get into things like technology and neurology, many of us can get overwhelmed, confused, or disinterested, quite honestly. But that's the beauty and practicality of our insight scanning technology that I want to show you. It's super simple and easy to understand. So we're going deep and getting nerdy, but if you're a parent who is up late at night searching for an objective test that will show what is going on in your child's nervous system, stick with me. We're talking exactly what electromyography is used for and how pediatric chiropractic can help your child. First things first, the nervous system is a two-way street. One set of nerves, called sensory nerves, send information and report to the brain and brainstem precisely what is going on both inside and outside the body. The other set of nerves are motor control nerves. Those send signals out from the brain and spinal cord and tell the various parts of the body what to do, when to do it, how to do it. Because neurological communication within the nervous system has to do this vitally important job for 37.2 million cells in the human body, things need to happen fast and have absolute clear lines of communication. We were designed to operate well past 5G, long before it was even invented, and we certainly can't have our kids operating at dial-up speeds. This particular scan, called the EMG or electromyography, is vital for us to help our perfect storm kiddos the best. It serves as the most important form of testing we can do when conditions like autism, sensory integration disorders, ADHD, and anxiety are being investigated. That's because each of these neurodevelopmental and neurosensory challenges are rooted in stuck tension, altered tone, and exhaustion of the neuromotor system. Most parents of a child on the spectrum or who struggles with sensory sensitivities are familiar with the word tone, having worked with outstanding professionals like pediatric PTs, OTs, and speech therapists. Neurological and tone challenges are a big deal, as motor function and development determine brain function and development. That means if the EMG scan detects patterns of stuck tension and imbalance, the brain is almost certainly stuck in sympathetic fight or flight tone and also struggling with an imbalance between its core functions of regulating emotions, behavior, learning, and memory. There are 3 common findings with pediatric EMG scans, and we'll briefly describe them here and then show examples of each below. A raging bull. This is a child whose nervous system is stuck on the gas pedal and entirely sympathetic dominant, leading to challenges with things such as hyperactivity, impulsivity, anxiety, difficulty sleeping, and so on. A drunken bull. This scan often correlates with a child struggling with coordination, focus, reading comprehension, communication, and so on. Then we have our raging drunken bull. A child who, as they get older, often end up with both scan patterns and signs and symptoms of each. The most exciting thing about neurologically focused pediatric chiropractic is that we can see changes in a child's EMG scans quickly because their nervous system is still learning to grow and adapt at such a fast pace. Their brains and bodies are growing and developing rapidly. It's quite incredible. But that also means that when subluxation gets into the neuromuscular system, it can wreak havoc and alter their development for years to come. Diving just a bit deeper into this particular scan, our Insight EMG scans also use a 3-step scoring system, which allow us to really understand what's going on with that child's neuromotor system and thus overall brain and neurodevelopment. Here are the 3 scores you'll see on your child's EMG scan and a quick explanation of what they mean, and we've also provided some examples below. So our total energy score. The score tends to go way up in a child who's wound up and stuck in sympathetic mode, and therefore a high score here is most often seen with our raging bull cases, struggling with things like anxiety, behavior, and sleep. Pattern score. This is a significant score to the overall neurological tone, and a low score here indicates a child who's likely struggling with emotional dysregulation, focus and concentration challenges, postural exhaustion, and a weak core, and so forth. Then our symmetry score. This score measures the balance between right and left sides of the neurospinal system, which is crucial to be sure that there is balance in overall brain function and coordination. The number one thing that signifies this child's scan as a raging bull scan is the excessively high total energy number shown in the bottom left corner, 413. The normal score should be about 100. This means that her entire neuromotor system is fully locked into fight or flight tone and interfering with her neuromotor development, which includes standing, walking. It's also interfering with sleep, behavior, emotions, digestion. Interestingly, this child is also a drunken bull, as shown by the other two low scores. For this child, her pattern score being low signifies she's struggling with drunken bull type neurological challenges, including emotional regulation, sensory processing, motor coordination, digestion, and more. The insight scans do exactly what they're named for. Give us insight and an understanding into the most crucial aspect of your child's health in ways no other health practitioner can. The nervous system truly is the mom of the entire body, keeping everything and everyone on track at all times. And just like quite few moms, it can get wound up and worn out. But it truly doesn't have to be that way. At TLC, we will put together a fully personalized and customized care plan just for your child. With each adjustment during that restoration, we'll see the stuck stress and tension leave your child's body and the calm, relaxation, and healing capacity kick in. We can't wait for you to experience miracles that only neurologically focused chiropractic care can bring to the table.